Hey y'all, welcome back. It's Sunday. Welcome, happy Sunday. Hopefully y'all had a good Labor Day weekend last weekend. We did. And so now we're back. This is series episode number 10. Get your paper, get your pen, get your notebook. Okay, so you can start taking your notes because this is going to be a really good one. So I'm excited about it. All right, let's hop into it. Oh, but before we do, make sure you subscribe to the YouTube channel so we can continue to get this information out in the algorithm. You subscribing and you sharing and you telling people about it helps to get the information out, okay? So please make sure that you are subscribing and getting that out, all right? Let's jump into the content, friend. So the first one is a controlled substance schedule number 3. And we're talking about the dosage form, right? Now, this is also known as Tussin X. This is the hydrocodone. And this dosage form is a suspension. And how do we know that it's a suspension? We know that it's a suspension because it is thick, right? Because a syrup is not really, that thick where you want to shake it up. So when you are looking at this, you also can tell, sorry, y'all, I had to put my phone on. Child, they be texting me. But when you look at this dosage form and it says suspension, when we see a suspension, we're always going to shake it well, right? And remember, I told you this before, you do not shake your syrup, right? I never seen anybody just shake their syrup up like this. Oh, I'm about to use the syrup on these pancakes. No. Okay, so don't be shaking that syrup. But this one here is a suspension, and a suspension should be shaken well. This is a Schedule 3. So how many refills are they going to get? 5 within a 6-month period. Yes, ma'am. Yes, sir. Come on, friend. I see you today, popping. The next one is Drug-Dietary Supplement, and this is which vitamin interacts with warfarin. The vitamin that interacts with warfarin is vitamin E. Vitamin E can be found in avocados. It can be found in broccoli. It can be found in spinach. It can be found in bell peppers. And remember, any green, anything leafy can interact with warfarin, and we do not want them to take it, okay? Vitamin E. This is a drug to dietary supplement. Also, warfarin is a narrow therapeutic index drug. So that means that this drug is going to be on the board exam. This is a common drug. So you want to make sure that you are being very careful when you're thinking about warfarin. This is something I want you to think about, okay, friend? Vitamin B1. So vitamin B1, if someone has a vitamin B1 deficiency, it could be a berry. Now, look, I probably didn't say that right, so don't come for me. But vitamin B can be found in salmon, crawfish. Look, if you love, first of all, if you in Houston, if you in the South, you know we love crawfish. I know I do. Look, I will wear my family out during crawfish season because we eating it every weekend. If I got a pick, we're eating it every weekend. That's either crawfish, shrimp, lobster. I don't really care for lobster that much, but crawfish, shrimp, and snow crabs. That's what I wanted to say. Lobster is good. That's my husband's favorite. Lobster is good, but it's not my favorite. But I prefer crab over lobster. But anyhow, child, I digress. Vitamin B1 can be found in crawfish, and all of the images and the pictures you see here, this good food making my mouth watering. And if there is a deficiency, it can result in the berry. Now, if you know how to pronounce it, please text me and let me know. Let me take a moment right here. 6K subscribers. I just want to thank y'all. Look, here go my award. I just want to say thank y'all so much for still watching the channel and still allowing me to speak into your life and giving me the opportunity to share my knowledge with you on this journey. I appreciate each and every one of you. 6,000 subscribers is not something that I would have ever thought I would have had, but you've made it all possible, and I thank you so much. I share this award with you, and I share it with all the other listeners that are out there, okay? Thank you so much. That's my speech. I hope y'all like it. But again, thank y'all for watching. Please continue to watch and subscribe so we can get the information out to other people, okay? COPD. COPD is a pulmonary disease. It affects the lungs. And if someone is using Spiriva, they may be using it for COPD. Spiriva is an inhaler. And so it can be used for COPD, and the generic is at the top, okay? Indications of medication. So when we think about schizophrenia, we know schizophrenia is something that affects the nervous system, okay? And schizophrenia is indicated, well, schizophrenia can indicate that there is something off in that nervous system. And so when you think about Abilify, you will know that Abilify is used to treat schizophrenia, okay? And the generic for schizophrenia is letter A. Letter A. Write that down because this is a drug that you will see again, top 200. Abilify is a part of that top 200, I guarantee you, okay? Smoking cessation drugs. So this is for somebody that's trying to let it go, honey. They are trying to let it go. One time I seen this, I used to watch This Is Us. Child, every time I would watch that show, I would cry, okay? But what's that girl name? So Randall's wife, I can't think of her name. Was it Tess or was that the child's name? But anyway, child, one day they had got into like a little altercation. I don't want to say altercation, but I think they both got into like a little heated something. And so he went outside and he found her and she was fake smoking like a cigarette. And there was nothing in her fingers, but she was outside doing that. And then it dawned on me at that time, I said, it's the whole motion of how you breathe in and you breathe out that also brings people comfort who smoke these cigarettes. And I had never looked at it like that before, but even when she was fake smoking, it was like she was still getting the breathe in, breathe out, in, out. And she was, and I was just blown away by the whole little way that they had done that. I know, look, child, look, these people trying to quit smoking, but even though she didn't have a cigarette in her hand, she was also showing us too how these people don't have to use the cigarette to maybe get the same effect of being relaxed. Look, y'all know I be reading into stuff, okay? Anyway, the letter answer for this one is letter D, honey. Generic name for Chantix is letter D, okay? Smoking cessation is for all the people who are out there trying to quit smoking. I'm here for you all. I know that there may be something hard. So friend, I hope that if you are a smoker and you have a desire to stop, I do hope that you're able to get that done, okay? The next one, now we're going to talk about the indication of medication. A patient is experiencing delusions, visual and auditory hallucinations. That means they seeing it, they hearing it, and they're coming up with these stories in their mind. Which of the following would be an appropriate treatment for this patient? And the answer is letter D, okay? Letter D. This is a generic drug, a generic name. And so the answer here is letter D, okay? Drug-to-dietary supplement. Which herbal product, when taken with ketoconazole, may result in an additive hepatotoxic effect, okay? And it's going to be echinacea. They can't take echinacea with ketoconazole, okay? Because it is going to result in a hepatotoxic effect, okay? So echinacea, B, letter B, echinacea, do not use that. Anti-eye drug, loop diuretic interacts with lithium. A loop diuretic is used to get the fluid off the body. It can also be used for high blood pressure and things like that. And when it is used together or in sync with lithium, there is an interaction there, okay? And lithium is also a narrow therapeutic index drug. Narrow therapeutic index drug, and it is a very common drug that is used to treat bipolar, Okay. Now, NTI drugs, here we are again with this warfarin. When they are using warfarin, it may turn their urine a red-orange color. It may turn their urine a red-orange color. And it could be, and remember, when the urine is turned red or orange, that could be caused by medications, food, or medical conditions, okay? But in this instance, this one can turn the urine a orange or red-orange color. I just want to thank y'all again for being a subscriber and watching the channel and allowing me to be a part of your journey. This is series number 10, and so we have a few more to go, and I am trying my best to get through them with you all and not make it long, make these videos long, because I do know that the top 200 drugs are a lot. And we have 2 more series to cover. So I am trying my best to make these videos short, easy, and simple so that way you're not overwhelmed, friend. But please continue to YouTube this channel, watch it, continue to share it with other people, and keep studying and being the best you can be, okay? You have to take your life one day at a time, friend. You didn't get here overnight, so it's not gonna be an overnight success, okay? Take it one day at a time, continue to show up for you, and things will continue to happen the way that you want them to. Continue to command your day. This is the beginning of a new era in your life, okay? Thank you so much for watching. I love you so much, and I can't wait to see you again next Sunday. Take care. Bye.